Hey everyone, my name is Megan Friedrich and I decided to do Agnosia for my term project for Psych 410, so I hope you guys learned something new. So what is agnosia? Agnosia is a rare disorder whereby a patient is unable to recognize and identify objects, persons, or sounds using one or more of their senses despite otherwise normally functioning senses. So, for example, someone with agnosia would not be able to recognize an ordinary object like a fork or identify a sound like a cough. When I was first researching agnosia, I found it really hard to wrap my brain around. So I'm just going to be providing a lot of examples because that was the best way that I was able to understand it. So breaking it down even more, there's going to be three main types of agnosia. The first is going to be visual agnosia, and this is an impairment in recognizing objects which are presented visually. It's the most common and best understood type of agnosia, and there are many forms of visual agnosia. And even though there's an impairment in recognizing these visually presented objects, there's normal functioning in the field, acuity, color, vision, brightness, discrimination, language, and memory for that person. So for these examples, there's the first, prosopagnosia, and that's the inability to recognize familiar faces, and this is because of damage to the fusiform face area. The next is simultanagnosia, and that's when you cannot recognize or sort different objects when they are together, but can recognize when alone. So like a pile of candy versus just one Jolly Rancher. And then topographical agnosia is when a person cannot orient to surroundings because they cannot interpret spatial information like I might be able to and others. They have a good memory of the layout, but they cannot navigate this area. And this is because of lesions to the right posterior cingulate area of the brain. So then, moving on to the second type, it's auditory agnosia. This is an impairment in recognizing sounds, even though all hearing is intact. And again, there are going to be multiple forms of auditory agnosia. The first is going to be phonagnosia, and that's when you cannot recognize familiar voices. Verbal auditory agnosia is you cannot comprehend spoken words, but you can write, read, and speak normally. And amusia is you cannot recognize music. And then for auditory agnosia, the right side temporal location of your brain is going to have lesions on it. And for tactile agnosia, this is because of an impairment in recognizing objects by touch. So you can only name objects by sight. And again, there's a couple forms of it. So there's going to be amorphagnosia, and that's when you cannot identify size and shape, like a triangle versus circle. And anasagnosia is when you cannot identify certain textures or weight of different materials, such as wood versus cotton and cotton versus metal. So then, again, to break it down one more time, there's going to be two forms of visual agnosia. The first is going to be apperceptive visual agnosia, and those with this form cannot properly process what they are seeing. This affects identifying shapes or differentiating between two objects, and this happens because of lesions to the parietal occipital cortex. And an example of this is if you have the same object, but you show it to that person at two different angles, this will be hard for them to recognize that it's the same object. And then associative visual agnosia, those with this form cannot match an object to their memory, so there's difficulty understanding the meaning behind what they are seeing, and this is due to damage to the bilateral inferior occipitotemporal cortex. So people with this can describe and draw the object, but they couldn't say its function. But also, if they're told like verbally what it is, then they can describe its function. So the etiology, agnosia occurs when there is brain damage along the pathways which connect primary sensory processing areas. So some examples would be a stroke, tumors, infections, dementia, carbon monoxide poisoning, and head injury. And agnosia can either present itself suddenly due to a stroke or a head injury, or it can present itself gradually, and this would be more due to tumor/dementia. And then different locations of lesions on brains can cause different forms of agnosia. So when diagnosing agnosia, learning the patient's history is very important because it'll point to the type of agnosia they have. If it is determined that they indeed have agnosia, because it has essential clues which are important for the diagnoses. And it also starts with a detailed interview of the patient, family members, and other caregivers because they're always around them. And then an initial assessment is done, which would include identifying common objects through sight, smell, and touch. And it's also important to test all of the patient's senses to make sure there are no primary deficits or trouble communicating. And this also helps to make sure that any other abnormality cannot be explained any other way, such as an unfamiliarity with stimulus, poor instructions, or an overlooked disease such as neuropathy or cataracts. So then to continue, neurological, psychological, and standardized testing of brain function is the next step. So some of these tests include the MMSC, which is the Mini Mental State Examination, and this is a screening test to evaluate cognitive impairment. The next is the Montreal Cognitive Assessment, and it assesses several cognitive domains to look for Alzheimer's, Parkinson's, Huntington's, brain tumors, head trauma, and depression. The ADAS-COG is the Alzheimer's Disease Assessment Scale Cognitive Subscale, and it assesses severity of the cognitive symptoms of dementia. And then Aphasia Boston Naming Test measures word retrieval in individuals and their comprehension of it. And then moving on from that, neurological testing is done for most people who are suspected of having visual agnosia because it can be identified this way through a head CT or brain MRI. So, unfortunately, there's no direct cure for agnosia. Most clinicians focus on treating the underlying causes of agnosia and then try to improve the patient's other senses. For example, they can treat and prevent for strokes, give antibiotics for infections, and or surgery for brain abscesses and surgery for the different brain tumors. Agnosia can also be managed supportively through rehabilitation, speech, and occupational therapy, and then this is to teach patients to use the intact sensory modalities to compensate. So again, just elevating their other senses. And then interventions can help the family and caregivers cope and learn to support the patient in their new environment. And then also just keeping the patient's main environment organized is important so they know where everyday objects are. Some good things to do would be to declutter and label everything. And so there hasn't been that much research done on agnosia, and it was previously thought that it was a very explicit diagnosis, meaning that the patient could either identify the object/sound or object, or they could not at all. But there's now research suggesting that some agnosic patients can process without awareness, so that would be like listening to music while you're studying and then remembering the words after. And it's most notable in patients who suffer from brain damage. And some examples include patients with written word agnosia and simultaneagnosia. And it's also a very controversial discovery, but it's an important one for those with agnosia. And then one of the more recent studies was with a boy named Al who had bad prosopagnosia, and that's when you can't identify familiar versus unfamiliar faces. So he was shown different sets of faces. Some were familiar and some were unfamiliar, and within those, they had more sets, and some of the familiar faces had hair and some did not. And this was to get him to focus on other facial features besides just hair and like glasses and more obvious things that will set a person apart, but more so to focus on like on people's noses, their eyes. And this was to increase his success rate in identifying familiar faces. It was pretty successful, but it also helped that he was so young because most cases of agnosia are not caught so soon. So here are my references. I hope you guys learned something about agnosia, and if you have any questions, feel free to reach out. Thanks for watching.